I'm getting older, so I've got notes. So happy 10th birthday to HCRW. I'm not going to sing, so don't worry. When I was first invited to give this talk, things that I would tell myself 10 years ago, I thought, oh, that's all right. I might need longer than 10 minutes, but I can do that. I can talk about the rejection. I can talk about how that's not the end of the world, how it's part of what you could think of as the academic life course. I could talk about the failed HCRW fellowship application that I turned into a studentship that got funded, so the proverbial failure to success story. I thought I could talk about that measurable dip in publications. If you plot my publications, you can see when I had my 3 children. And believe me, it's causal. It's not correlation. And all that dip, that's okay. Because academia is a long game. So accept those dips, be kind to yourself. But then I realized 10 years ago, I wasn't an early career researcher. I was what we might call an emerging leader. I just got my first large MRC grant, and that was built on a whole load of smaller grants funded by NISCA, which was HCRW as was, the first of which was only for 12.5 grand. So, things scale, and appreciate that. I was chairing cross-sector meetings, I was talking to policymakers. In short, I was mid-career. And we talk a lot about early career researchers, but we tend to focus less on what happens next. The transitions, the letting go, the losses to make room for others as you emerge into mid-career, the managing the chaos of teenagers rather than toddlers. And believe me, it's just as chaotic. I hate to say it to you, but it really is. And the absolute joy of developing a deep expertise in a topic area. I really value that as my career has developed. And then settling into yourself. Mid-career, you settle into yourself. And by that, I mean there are things that I had once hidden about myself that actually I came to see as strengths. And I think those things took my career to places that I hadn't really imagined. So this is a photo of my grandfather. He's the one in the very impractical... That's not a photo of my grandfather. He's the one in the very impractical white trousers. So he looks different, doesn't he? And he was. He educated his daughters. That's pretty unusual for India at the time. And because he educated his daughters, my grandmother became an English teacher, then had 8 children, and eventually became a headmistress in a girls' school. I can't imagine what the working maternal guilt was back in that time. And then my mother, her daughter, did postgraduate qualifications in maths and came to the UK back in 1966. And she gave up her first job because they wouldn't let her wear a sari. But I wasn't like that, because I grew up in North London, and I grew up sitting between 2 cultures, and I wanted to fit in. I didn't want to be different. I wanted to feel comfortable in all these different spaces. And I learnt to blend, observe, and adapt. And what I'd say now to the me from 10 years ago is this, is that your difference is something to stop hiding. Because actually, it's, I think, what gave me an edge. I think growing up between two worlds gave me empathy. And that helped me clinically, absolutely. But it also helped me academically, because it gives you empathy. It enables you to perceive things from other perspectives. So that helped me connect with people with lived experience, with policymakers, with ethnic minority female academics that I mentor across the country, both formally and informally. You know, I can say to them, you're not imagining that. And that's based on that discomfort, that empathy, that connection, and also experience. But those differences, I think, also made me a better researcher. It taught me to see what others overlook, to question assumptions, to see connections where others don't see them, and sometimes to ask the question that everyone else is too polite to ask. And that's because I'm used to feeling uncomfortable, and I'm used to being a bit different in the room. And I think what that led to was sometimes changing the narrative. So in suicide prevention, when I first started working in it, was dominated by psychiatry. Me and my team changed that narrative. You know, there's a focus on primary care now, which is also where I came from. We also challenged that narrative that men don't seek help. We did a piece of research that basically showed men do seek help, and they increasingly seek help before suicide. They don't seek help as much as women, but it meant that campaigns like It Takes Balls to Talk, which puts the onus on men to seek help, could change into things like Samaritans Wales did a talk called Open Up, that's for men, but Listen Up, that's for us. Because actually what our research showed was that men do seek help, and maybe we don't respond to men in distress in the same way that we respond to women. My background also means that I play things straight. I think in research it can be really tempting to over-egg your findings, you know, to act like they mean more than they actually do. And if you don't do that, it can feel like you're selling yourself short. But actually, integrity matters. In a world of limited public funding, we're not playing Dragon's Den. We're advising on the best evidence to inform choices in policy and practice and inform the advance of knowledge. Be honest about your findings. We were. We did a study about children and young people with mental health problems who self-harmed or who were neurodiverse. And we showed that they were in school less through absence and exclusion. And when I talk about that, it got published in Lancet Psychiatry. We were chuffed. But when I talk about that, I say, it's not rocket science. Anyone working in education knows this. But what we did was put evidence around that. We used the SAIL data bank, and that real-world evidence spoke to policymakers. I've been given the 1 minute, and I've still got another slide. So I'm gonna move on and basically highlight uncertainties. And then my last two messages to myself have been echoed by the other speakers. Stick with your passions. You know, I stuck with suicide prevention and mental health in children and young people, even though mental health funding is quite poor. You know, compared to cancer, we get £9 per person who's unwell. Cancer gets 178 for research. But that lights my brain up, and that passion means that you can translate into change and stick through all those ups and downs. And my final message is know your privilege. Who gets paid to think and read? We do. Keep that wonder. So, to the me from 10 years ago, thanks for sticking with it. To the me in 10 years' time, maybe I'll be back to tell you what happened. Thank you.